So it wasn't until soon after this that the germ theory came along and people started understanding how disease processes worked, and everything changed after that. So again, this is a picture that just shows the difference in the horse population. This is my hometown, Shelbyville, Kentucky, and up in the left-hand corner is a dedication of a fountain in Shelbyville, Kentucky in 1895. And you can see that the town square is chock full of horses. And the next picture on the right is that same Main Street in 1909. And you can see that the highway's full of cars. And there's a train track that runs up through the middle of town now that's a trolley car that went from Louisville to Lexington. So now nobody has a horse that's going to town. They're all going to town in automobiles or the trolley or the train. Now, things really changed in the late 1800s with the discovery of germs causing disease, and we started learning about aseptic techniques with surgery and different types of disease processes. And these guys were the scientists that changed our life and really changed veterinary medicine, because up until this point, nobody really cared whether veterinarians were well trained or not, because it wasn't of any economic interest to anybody to really educate them in pathology and the different sciences. But once Koch and Pasteur and McFadden showed that diseases were caused by bacteria and you could do things to treat them, but you had to have a medical education to do that, then the states got on board and started up in the game as far as who could say they were veterinarians and not, and that they actually started training veterinarians in medical practice. And human physicians were at the same point at that time. They were very poorly trained. Most were barber surgeons, and amputating a leg was about all you had to know how to do if you were a human doctor, Lance Boyle. So things began to change rapidly around the turn of the century. Smallpox and cowpox, rabies, we identified the organism for that. Tetanus toxoid, an antitoxin came along about that time. And so as World War I approached, we were still using horses, but we had access to other modes of transportation. But disease processes became a big deal in the war. And it was a huge economic loss, and especially from things like strangles and glanders and farcy and those diseases that some are now pretty much extinct in horses, that there were huge economic losses to all of the military services. And there were large numbers of horses that the military had. In between World War I and World War II, there was some pretty good research that was done in equine dentistry, mostly done in Germany by Becker and Lew. They were the ones that sort of discovered how horses masticated. And this was a mologram that was used to measure the occlusal cycle of a horse and the masticatory cycle, and how the jaw moved differently if you fed different types of forages and grains. This is there are a couple of pictures of Erwin Becker, who was trained as a German engineer, and then he married the niece of Heimler-Dunn. And Heimler-Dunn was a veterinarian that had an acute interest in animal dentistry, all animals.